The mental weight of this term is what makes this term hard. So I'm talking 12-hour clinicals. It's it's gonna make or break you. Kudos to you. Definitely take some time out for yourself. You're definitely gonna need it. And nobody talks about how mentally draining that cycle is.
And it goes a little something like.
Hey guys, it's Zoe and welcome back to Zoe and Amaya. Today we're talking about term 13, acute care nursing. And this term is where everything changes because you're only 2 terms away before it's official and you graduate nursing school, and then it's just the NCLEX. And that's another situation in itself. But before we get into today's video, make sure you like, comment, subscribe. It helps us grow a little bit more, and so this video can get pushed to more nursing students like yourselves. Academically, acute care focuses on high acuity adult patients in a hospital setting. So you go deep into myocardial infarctions, heart failure, dysrhythmias, cardiogenic shock, hypovolemic shock, septic shock, R's, pulmonary embolisms, like you name it, you go over it. It is Med-Surg and everybody's least favorite thing. You also go over advanced IV medications, blood transfusion reactions, and telemetry interpretations, electrolyte imbalances, and rapid deterioration protocols. I know that was a mouthful, but this term, I mean, it's gonna make or break you. But this is where labs start meeting everything like potassium, magnesium, lactate, troponin, especially troponin. Those numbers tell you who is crashing next. I feel like the most common one out of those I see is the troponin drawn regularly. So it's not surface level anymore. It's very layered. Now that that's out the way, let's talk about clinical. So this term is where our clinical days were long because it fell on Thanksgiving break. So I'm talking 12-hour clinicals where you leave before the sun comes up and go home when it's dark. Like those were the longest clinicals I ever experienced in my life. We were in the ED at the worst ED like in Charleston. So you're on your feet most of the time, and charting, passing meds, reassessing. Well, you're not going to call providers, but watching your nurse call providers, watching monitors, helping your nurse or the other patients. Like as a nursing student, you're assigned one patient, but you're following the nurse. So whatever she needs help with, that's what you're going to be doing for the rest of the day. I realized nursing isn't about tasks, it's about pattern recognition. Don't be so task oriented. Have conversations with your patients. Pay attention to the trends. Pay attention to their labs. It's very hard as a new grad to do that because you're trying to like figure out everything, the scopes and all the other stuff, the systems that you'll be working with. But try your best to pay attention to trends and listen to your patient. It will save you a lot of heartache. It will save you a lot of trouble. 9 times out of 10, the patient knows themselves better than you. So I always listen to my patient. Like if my patient isn't comfortable with something, I will reach out to the provider and say, hey, so-and-so isn't comfortable with this, that, and the third. Can we maybe find another solution? And 9 times out of 10, there's going to be another solution for the patient. Healthcare is not a one-way street. There are so many different options. So just pay attention to your patient, pay attention to your nurse when you're in clinicals, especially if you know that you want to work there, maybe at that company, and you have clinicals there. Definitely pay attention and network with people so that way you can have maybe an easier time getting into the job that you want. The mental weight of this term is what makes this term hard. It's not necessarily the assignments, so you kind of already know like what you're doing. You already did Med-Surg 1. Like it's just the mental weight of it all. It's already you're at the final stretch. You're exhausted. Life is happening. Life is lifing. But from my experience, this term really humbled me because you start realizing that in life, in real life, there's no multiple choice answers popping up. It's you and your judgment. Clinical thinking skills. So the hardest part wasn't memorizing content. It was trusting yourself and that you know what you're talking about, that you know how to apply the information and the challenges that are coming your way. If you had 12-hour clinicals, like if your clinicals or your term falls on a holiday break, kudos to you. Definitely take some time out for yourself. You're definitely going to need it. It's going to be exhausting. It's going to be tiring. especially when you're not getting paid for it. I think that's one of the hardest parts too. Like, I'm doing a 12-hour clinical and I'm not getting paid for it. Like, this is basically free labor, and I didn't have a job at the time, so that was the hardest part for me. Like, I'm doing free labor, like I'm working, but I'm not getting paid. Like, hello. And nobody talks about how mentally draining that cycle is. Like, going to clinicals, studying, going to clinicals, studying at clinicals. But then your nurse, if you have a bad nurse, like, why are you sitting down? Our nurses at that clinical rotation are like, why are y'all just sitting around talking? We have care plans to do. We have assignments to do. What do you mean? We're nursing students. Like, we don't work here. We have to juggle both. Like, we're here for 12 hours and we have a test tomorrow. Yeah, it's just like a never-ending cycle of just like study. So when you get out of nursing school, make sure you take maybe like a 3-month break before you start a job. If you're able to, before you start a job, go on vacation, do fun things. I know before I started my new job, I went to the Virgin Islands and we had a good time. I took a 2-month break, and then I started my new job, and then a month after that I started my BSN program. So just make sure you take a short break. Even though this was a stressful term, it was a term that was also like, okay, I'm becoming a nurse. This is almost it. It was hard for me to envision myself like outside of nursing school because it's like a whole long period of your time. But like, okay, this is it. Like, we're at the final push. I was excited to go to the next term, even though I was know that term was gonna be busy. I was excited to go to the next so I could be done with nursing school and put it behind me. Like, even talking about nursing school, I don't even want to think about it. Okay, it's just stressful. Now your BSN program, not stressful. It's that first degree, nursing degree, that's stressful because you have clinicals and all that stuff. So definitely lock in, because sometimes I'm working and I'm like, I kind of wish I was in nursing school right now because the job could be a lot. Being a nurse is a lot. Like, at least when you're a nursing student, you don't really have all the responsibility. But when you graduate, it's like, okay, now all of it's on me. So cherish these moments as well. What caught me off guard, not even just on a med-surg floor, you need this throughout all of nursing, but how much prioritization matters. In school early on, you can kind of focus on one thing at a time, but in acute care, you might have one patient with unstable vitals. You might have another patient needing pain meds, and you might have a provider asking questions. So, like, which one is more urgent? Okay, the person needing pain meds, it's urgent, but how urgent? Depends on the provider's question. Like, how urgent is that? Can it wait? Can you get a call back? You know, it just depends on the question and what the provider needs. And you have to decide what could kill somebody first. That shift in thinking is what this term trains on. Now that we've talked about like what to expect for this term, in my experience, let's get into some NCLEX-style questions. I wish I could do NGM questions. I find this a little bit harder. I have to like insert it here. I wouldn't know you guys' answers. I don't know. I wish I could do NGM questions. Question 1. A patient with sepsis has a BP of 82/48, a heart rate of 126, a lactate of 5, and a urine output of 15 mLs an hour. What is the priority action? A. Administer IV antibiotics. B. Begin rapid IV fluids. C. Apply oxygen. Or D. Draw repeat lactate. Question 2. During a blood transfusion, the patient reports chills and lower back pain. What should the nurse do first? Back again with that prioritization. A. Slow the transfusion. B. Stop the transfusion. C. Notify the provider. Or D. Check the temperature. Question 3. Which patient should be assessed first? A. A COPD patient with a SpO2 of 89% on 2 liters. B. A CHF patient with +2 edema. C. A patient with a potassium of 6.3. Or D. A post-op patient with pain, 7 out of 10. Question number 4, the last question. I'm pretty sure it's the last question. A patient with cardiogenic shock will likely present with A. Warm flushed skin. B. Pulmonary crackles. C. A bounding pulse. Or D. Increased urine output. And since that was the last question, sound off in the comments on how many you got right or wrong. And if you got it wrong, what was your rationale behind that, and why did you think it was the correct answer? All right, guys, so that wraps up today's video. If you're in a 12-hour clinical right now, comment how many hours your shift is. I want to see who's surviving with me and who went through what I went through during nursing school with 12-hour clinicals. Even though right now, there shouldn't be any, the time that I'm posting this shouldn't be any 12-hour clinicals. There's no major holidays. But if you're watching this around December, November, most likely you have a 12-hour clinical, and I feel your pain. And if you already finished acute care, comment I made it so the students coming behind you know this term is survivable. And again, if you like these questions that I put in these videos, like, comment, subscribe, and share this video with your nursing school friends.